broader range of age groups, and as we drive demand for that vaccine, in other words, as people want to get that vaccine, we believe that with high vaccination rates, we can then begin to significantly affect the transmission dynamics of the virus, but not until then. So there are two phases. One is controlling death and severe disease, and the second phase is controlling the actual transmission of the disease. Right now, what we do have at our disposal are many measures that can significantly change transmission, and that is physical distance, avoiding crowded places, hand hygiene, wearing a mask, and all of the other things that we've all been speaking about. These are the measures we have at our disposal. Beyond that, I think Maria, who may be able to give you some more specifics. So we're at a moment, an inflection point in the pandemic, but we're not at a point where we can walk away from what we've been doing already. We ask that people sustain the effort, sustain their behaviours, work in communities to drive community behaviour, and we hold ourselves and governments accountable to provide the necessary support to communities to sustain those behaviours in the coming weeks and months. Maria?
Thanks, Mike. I'm sure others will also want to add to this because it's a great question. I think the next 6 months are going to be difficult but hopeful. And I think they're going to be difficult for a number of reasons because we need to have the patience, we need to put in the work to keep ourselves safe and to keep our loved ones safe. I think the next 6 months require from all of us, even in countries that have driven down transmission, have controlled COVID transmission, we really need strict adherence and vigilance to keeping ourselves safe. It's putting in all of the measures, carrying out all of the measures, taking a risk-based approach, each of us, to our daily actions from when we wake up in the morning to when we go to sleep at night for ourselves and our families. And I think we need, as we take that risk-based approach, our actions will depend on the virus circulation where we live. We will continue to need to make modifications to our behavior depending on how much of the virus is circulating around. In countries that have controlled COVID, there's more movement, there's more freedom to be able to do the things that were, quote unquote normal. But I know we're all dealing with this new normal and developing and learning what our new normal is. But I think the real critical factor here is the decisions we make right now can change the course of the next 6 months. The steps that we take now mean life or death for us and mean life or death for our families. And I think that everybody needs to, and they do, understand the importance of that. This toolkit that we have an incredibly powerful toolkit right now, which include individual level measures that all of us can take. It's the physical distancing, it's the wearing of masks, it's the safe wearing of masks, making sure that you have appropriate hand hygiene before you put the mask on, when you take the mask off, making sure that you clean your hands many times per day, making sure that you open a window if you're in a crowded space or they're in a space that has poor ventilation. Those individual level actions are really important. Vaccination will be another incredibly important tool that we add to our toolkit as those vaccines come online. Knowledge is part of our toolkit. Knowing where the virus is, knowing where it's circulating, what's happening around where I live, where I work, and using that knowledge to make decisions that reduce your risk. You hear us talk a lot about know your risk, lower your risk. Take those actions to be able to protect yourself and to protect your loved ones, because these actions are saving lives now. And as many steps as we can take, as many infections that we can prevent, mean lives saved. So there is no shortcut to putting in the work over the next 6 months, but the trajectory of this in all countries depend on our actions. In the countries that have brought transmission down, they need to keep it down, make sure that it stays low. We're seeing a number of countries that have turned a corner. Many countries across Europe, which are now seeing reductions in transmission, we need to keep that up. We do not want to be in the same position we were in the spring and going back and forth between lockdown or so-called lockdown and opening up and lockdown and opening up. We can keep that transmission down. And as we enter into this critical holiday period right now, really consider what you do over this period and who you interact with, because if you could modify your contact patterns, you could modify the virus's ability to spread. So we need to put in the work. I think it will be difficult. We need patience, but it was a hopeful next 6 months.
Just some brief words, because there's so much hope around vaccines right now, right? And actually, when you look at the next 6 months, we can't be lulled into a false sense of security, but at the same time, we need to maintain the hope in our hearts, because we are seeing that science is advancing quickly, more quickly than ever in our lifetime. But at the same time, the reality is we will have other vaccine candidates being finalized in phase 3 results in the first semester. Then these vaccines, if they are successful, they will need to be licensed or an emergency use authorization by WHO or others, and they need to be manufactured in enough quantity. So let us say that the next 6 months, it's not over yet, but we have hope with appropriate care. So let's not lose the focus, and let's keep hope with care. Thank you.
Thank you very much. Yes,
Mike, I fully agree with Mariangela, but we also have to be extremely clear at this moment with countries that currently have high levels of transmission at the end of this year, or up to the end of this year, are going to have to sustain very strong control measures, or this disease will blow out of control in some of those environments. And they will risk ongoing epidemic yo-yo situation through 2021. There needs to be an aggressive scale-up of public health surveillance and control measures in countries that are currently experiencing very high incidence, because you've got to get transmission down to a manageable level. And then the vaccines will come in and make a huge difference quickly. I've heard our colleague Tom Frieden talk about the 1-2 punch. We need to take the virus out through public health measures, and then we need to hopefully finish this virus with the vaccine. So I couldn't agree more with my colleague Mariangela. We have to sustain that hope. But those countries currently in the fight of their lives, you have got to stick with this. You have got to try and control this transmission, or your health systems will not be able to cope. Some countries are turning that corner, and I believe will sustain those control measures. Some countries are not, and some countries are actually going back into very high transmission levels, and there is no prospect that vaccine will end that transmission in enough time. And I think this is the difficult dilemma that everybody faces. We're all tired, and I agree, and we need the hope. I need this hope, and thank you, Angela, for the message of hope. But we also need to be realistic. We're in a pivotal moment in some countries. Some countries' health systems, not all, not that many in fact, but there are some countries on this planet whose health systems are at a point of collapse. And right now we have got to take the heat out of this transmission in order that those health systems can cope and bring that vaccine on as quickly, as safely, as efficaciously. And as our previous colleague said, we've also got to drive demand and convince people and continue to convince people that this vaccine is a safe and efficacious way out. I have seen vaccines transform the world and change the course of epidemics, and I fully expect that these vaccines and the